Okay, excellent. Now, I think TMJ is something that you also deal with quite
Yeah, yeah. I
frequently.
see a lot of TMJ patients here in my office. The typical TMJ patient is a young lady with just a joint that's become sore, but certainly we see the whole range. Again, old to young, guys to girls. We have a number of uh, different procedures that we can offer. Most patients, however, are not going to end up having surgery for their TMJ problems. We're going to treat them in a conservative medical management protocol, provide them with occlusal splints and maybe some steroid injections or a procedure called arthrocentesis where we wash the joint out. The studies show that arthrocentesis and some of these steroid injections can be up to 90% successful to relieve pain for 6 months to a year. So it's really something that we can offer. But then at the same point in time, if the patient continues to have pain or we have findings on MRIs or radiographic studies that show that there's real pathology in the joint, we can go ahead and take them to the hospital and provide surgical alternatives also for TMJ problems.
Okay, so and I'll be honest, I don't fully understand what TMJ is. Could you tell me a little bit about, kind of what are some of the common symptoms that people have with TMJ and, may not even know about?
Sure. So TMJ actually just means the temporomandibular joint. We all have TMJ. There's two of them. There's one on each side, and that's just the hinge that the jaw functions off of. This is the most complicated joint in the body, in that there's two of them that are connected to each other, and one cannot function without the other. Typically, when I have patients coming to my office with TMJ problems, it's either pain in the joint, swelling in the joint, clicking and popping, and limitations of opening. So if you can think about spraining or straining any other joint in your body, whether it be a knee or an ankle, the same things can happen to this joint. The difference is if I sprain my ankle, I'm going to, chill out, elevate it, not go exercise for a couple days, maybe a couple weeks, and let it heal up. We never give this joint a rest. We're always chewing, we're always eating, we're always talking. I find that most patients are doing some clenching or grinding at night too, and so there's a number of different things that we're going to try and correct for these patients. We're going to try and decrease the muscle tension and spasms that they have by using appropriate medications. We're going to bring down the swelling and pain in the joints by using non-steroidal anti-inflammatory medications or steroids as needed. We're going to provide them most times with a physical therapy consultation to help regain the range of motion in that joint. And so we treat it just like you would any other joint, really trying to decrease the pain and swelling and increase function. And then, as stated, if we have severe enough dysfunction, we're going to go ahead and move on and do surgical interventions.
Gotcha. So the bottom line is, if somebody's having, a lot of pain through these joints or things along those lines, it's probably a good idea to see an oral surgeon about that.
Certainly. Pain in the joint, pain in the muscles associated with chewing. So here in the temporalis, the masseter muscles, those are patients we like to see. Common things that I guess precipitate the need to come in and see us. A prolonged dental visit after which, man, that joint is just hurting me and I can't chew or close. That's a common presenting history for us. We'll get patients who it's been progressive. It's been kind of a slight pain on and off, and then one day there's a big pop, and now they can't open. Their openings, maybe 15 to 20 millimeters, and they really just want to be able to open and chew again. I had one gentleman who told me that he was eating a soft cinnamon roll, and then all of a sudden he couldn't open again. So, I felt bad for him, and we got him functioning again and feeling good. So,
it's hard to function if you can't eat.
That's right. What I tell patients is it's not a quantity of life issue, it's a quality of life issue. You're not going to die if your joint is sore, but man, your quality of life sure is going to be affected, and so we like to address that and help patients be comfortable and functional again.
Sure. Okay.